Hello, everyone, and this is Katina Morrison, your host of the Inflamed Sisters Thriving podcast. This is the Inflamed Sisters Thriving podcast, a safe space created to guide women living with chronic illnesses to their best quality of life. It is created to help you uncover your purpose by doing what you were meant to do, move in power by advocating for yourself, and achieve strategic growth in your health, career, and business. We will educate, inspire, and motivate you as we show you Inflamed Sisters thrive together always. And today I have my amazing guest, Dr. Elena Alawa. I would love for you to introduce yourself to our audience.
Thank you, Katina. It's a pleasure, and I'm happy to be here and excited to be with you on your show. My name is Elena Alawa. I'm a board certified osteopathic internal medicine physician, also certified in functional medicine and bioidentical hormone therapy. And in my private practice, I focus on transitioning women and men through perimenopause, menopause, and andropause naturally and holistically.
Wonderful. And it's always wonderful to come in contact with doctors who not only are have learned things both ways, whether it be what is quote unquote the medicinal way to what is good for a person natural and holistically. I love when especially when professionals take it to the next level to learn and do the things that can meet their clients or patients' needs in a natural and holistic way. So, can you, there's more about you though. Besides being trained in these areas, you too actually live with chronic illness. Can you explain a little bit about your journey?
Yes, absolutely.
Hmm.
So I trained as an osteopath through conventional medicine, but I was always open to natural remedies and approaches to diseases or chronic diseases in general. So the idea is not to diss conventional medicine, but to actually integrate all the benefits that both of them can combine and bring forward to help people navigate through life the best way possible with minimum side effects or discomforts.
Hmm.
My personal journey through perimenopause is actually what brought me to switch focus from osteopathic conventional medicine to more naturopathic and holistic medicine. This is because after my third postpartum, was about 40 years old, and I was experiencing significant depression, tearfulness, freezing frontal headaches, literally freezing and on my forehead to the point of complete visual loss. And I wasn't getting results that were satisfactory from physicians that I went to see in consult. So I had MRIs and blood tests, and yes, everything was great and normal, but I was still left to suffer with symptoms. So I decided to start my personal journey to further discover and train in functional medicine and bioidentical hormones, and figured out a way how to heal myself naturally. My progesterone was almost non-existent, so that's why I'm now on progesterone to balance the estrogen, not to overpower the effects of the estrogen. But I'm also on natural supplements and have changed my diet to decrease that inflammation that our environment and regular diet was bringing it on to my body. And I also have rheumatoid arthritis. I was diagnosed with this at the age of 24. And at the time, I was seeing allopathic physicians that unfortunately were not driving the message home that inflammation needs to be decreased. So I was exposed to methotrexate and biologicals such as Enbrel, something to really quiet down the immune response, but do nothing on treating the foundation, how to decrease the inflammation from starting and being promoted in the first place.
Hmm.
So by the time that I finally embraced functional medicine and naturopathic medicine, I was left with significant destruction of cartilaginous tissue in my joints. So from now on is just maintaining a natural lifestyle in order to decrease that inflammation from acting up and causing flare ups.
Got it. So, embracing that natural lifestyle, and your journey taught you so much about, the inequities of just focusing on medicine, and how there needs to be that integration of the two. And there are a lot of doctors who are leaving just the normal, quote unquote, medicine practice to integrative, or functional medicine as well. And I have had the privilege to come into contact with quite a few. And I'd love to see, especially those who have a journey like yours that includes rheumatoid arthritis and experiencing the symptoms of perimenopause and the impact that it has, so that you can actually relate to your clients and provide them tools and treatments that actually can be beneficial to them. So you mentioned about embracing the natural lifestyle, or things of that sort. What are some things that you recommend that will help a person who is going through, for instance, that perimenopause phase or menopause phase? What are some natural ways in which they can help their body to heal?
Definitely lifestyle.
Mhm.
Everything that encompasses lifestyle, from diet to exercise. Diet, because food is medicine. So, what we put in our body does matter. And people should consume as much as possible, if not 100%, organic whole foods. If not possible to read every single label, which I don't really recommend, just stay away from the aisles, shop from the perimeter of the supermarket, of the shopping center, and just get produce. Produce that if you look at and you know that this is an orange or a cucumber, well, that's great. Put it in your cart, go home, find some recipes to combine all of these, and eat the rainbow. Eat a variety of organic products, because they influence your microbiome, and your gut health is very important, because it's what um, it is the gatekeeper to hormone balance and overall health and nutrition. A good balanced microbiome, that balance between good and bad bacteria in your gut, and that can be influenced negatively by antibiotics, antiviral medications, processed foods, any kind of endocrine disruptive chemicals that we are exposed to, fire retardants, cosmetics, and things like that. Eliminate everything or anything that is around you in plastic, styrofoam, or hard plastic form. Those are your endocrine disruptors that have estrogen mimetic activity, meaning they attach onto estrogen receptors but produce not an estrogenic like exactly action onto tissues and cells. So you want to stay away from those. I'm talking about BPAs and phthalates. Those would be your plastic bottles, styrofoam containers in which you store food. Never warm up food in these kind of containers. Cook in cookware that is stainless steel or ceramic, or wrought iron, but avoid anything that can leach chemicals into the food, and store in glass containers with maybe a hard plastic top that you can remove when you are to warm up your food. And then exercise. You need to move. It's not the form of exercise as much as the movement itself. If you just go for a walk, maybe every day, that would be beneficial. If you do high
Mhm.
intensity interval training, 3 times a week, you really need to rest your body in between, because if not, you're stressing your system more, and then you're putting strain onto your adrenals. And also sleep well. But women going through perimenopause by default are not going to sleep well, just because of their oscillating, fluctuating hormones. So, hormone balance, again, plays a very big role in harmonizing everything and allowing women to get their rest. Why? Because when we rest and when we sleep, our cells regenerate, they
Mhm.
heal themselves. So our body has an innate ability to heal itself if given the proper things to do so.
Wow, and you have given us a lot of the proper things to do, an overview, and I appreciated that overview. But there's one thing I caught in that overview that you mentioned that was quite detailed, and that, listen, I'm coming back and listening to this myself to apply, especially as a woman in menopause. because I definitely need to apply it. You mentioned that you don't recommend that people read the nutritional facts or all the things that are contained in a food item. Why is that?
It's because most of the things that have a plastic wrap, it's going to be a processed food. So you're going to
Mhm.
find words that you will not understand. Everybody lives with a phone in their hand or in their pocket these days. So I doubt that even 1% of people who are purchasing these products are actually going to their phone to search for those individual chemicals and see that they are synthetic chemicals, or
Mhm.
petroleum based products that should never be as part of our diet. So, a very simple piece of advice: if you cannot pronounce that name, it's something synthetic, just put it back down on the shelf and just move on. Go to the perimeter of the shopping center, buy organic foods, things that are nutritive, things that are grown on regenerative soil, things that will give you the nutrients that you need to absorb. So getting the nutrients is one step, but being able to absorb them is the second step that it's very important in maintaining our health. So that's where gut health comes into play. We need to have the proper balance of stomach pH. We need
Mhm.
to be able to absorb these nutrients that we take from the foods that we eat in order to provide the substrate and cofactors for our hormones and neurotransmitters in order to harmonize our hormones.
Wow. So gut health is something that is a word. Gut health is two words that is being used a lot now in our times. And a lot of people are going into practicing it, or they're talking about how important and vital it is. What are ways in which a person can really regulate their gut health? Besides going to that perimeter, is there more that they need to know?
Of course, they would need to seek services from a functional medicine physician, because a functional medicine physician will be talking about all the aspects of gut health. And while this could maybe apply to everybody as a blanket statement, but this really needs to be individualized according to each person's current lifestyle and choices, as well as their past medical history, because certain things will trigger the thought of what's going on, and then you will need testing, because if you don't test, you guess. And instead of throwing the kitchen sink at the patient and see if it sticks and if it's actually improving something, it's better to know the root causes in order to address them specifically and one by one, or all together if affordable, in order to improve that health.
Hmm. Understood. So that's another key word, affordable. Because it's very expensive to manage your health with medicines. I know I take a very high cost medication myself, and getting it covered by my insurance at time is quite difficult. But it has been helpful for me to manage my rheumatoid arthritis, and I've noticed a great difference with it. But the nutrition, going the natural holistic way, can sometimes be as expensive, or do you disagree?
I disagree to
Mhm.
the extent that I don't consider it a cost. I consider it an investment in your
Mhm.
health. Not you specifically, in one's health. So
Yes.
if one did not get to this point from yesterday to today, it took some time, months, years, in most cases, to get to this dysfunction. So in order to treat it, you really need to invest into good quality supplements that are professional grade, not what you find at Rite Aid and CVS and GNC, because those are contaminated, have fillers, have things that are not even present when compared to the ingredients listed on the box. So you need to take something that it's not rancid, especially when we talk about fish oil, because rancid fish oil, even though checkmark you took it, but that increases your inflammation. So when you're trying to fight inflammation and you're ingesting something that is promoting more inflammation, you're not really moving forward. You're, instead of stagnant, you're actually going backwards. So
Mm.
I find that to be an investment in your health. You're not going to be on these supplements forever. It's a matter of readjusting your mindset and making better choices in your lifestyle, that it's going to get you to a health level where you will not be dependent on these particular supplements. You're basically re-optimizing your natural hormones, because hormones are what drive our existence from birth to death, basically. So when you're diagnosed with hypothyroidism, you're taking thyroid medication. When you're diagnosed with a sugar problem, you're maybe taking medication or insulin. But when it
Mhm.
comes to sex hormones like estrogen, progesterone, testosterone, DHEA, and steroid hormones such as cortisol addressing adrenal health, nobody's doing anything. Why are we ignoring them? Because that's what drove your pre-perimenopause stage, that fertile 20 to 40 average age, to be in your best shape and form.
Mm.
So why ignore them, or why take antidepressants and benzodiazepines, sedating medications to treat symptoms that are related to perimenopause and menopause? If we just look at the foundation, hormone health, but everything, or I'm sorry, hormone balance, but everything that drives back, like precursors of hormone balance, lifestyle, what you're eating, exercise, sleep, gut health. Gut health should be the backbone of hormone health pyramid. Like if you think of the food pyramid, think of it as an optimal health pyramid. At the very bottom, the foundation should be gut health. So I see it as an investment in your health, adjusting, learning how to make better choices that benefit you ultimately.
Hmm. All right. An investment, not an expensive cost, but an investment in the best care for your body because it's natural. Um,
Absolutely.
so I agree with you completely on that. Now, I talked a bit about my journey as a woman who has multiple chronic illnesses. And recently, I had a breast cancer scare. And during that breast cancer scare, I was advised by my doctor due to atypical ductal hyperplasia. It was recommended that I have a double mastectomy. And one of the things that happened was I happened to be talking to you at one of my most anxious times. And I want to thank you because at that moment, you may not have known the impact that you were making, but it actually helped me to switch my brain to understand that I needed to advocate for myself and not just resign to allowing the physician to dictate what was in my best interest, because a second and a third opinion is always important, especially when something as drastic as a double mastectomy is recommended. So, when I talk to you, would you mind kind of sharing what was your thoughts when I told you that a double mastectomy was recommended?
Okay, I'm gonna try. I think this is kind of a personal story for you, so I don't want to share too much and put you on the spot. But
Hmm.
for any women out there who are listening, just to know that seeking a second or a third opinion, not necessarily to get what you want and the answer you're looking for, but to see if that answer is more a uniform answer. If two out of three physicians will agree, then do your own research and see if you're agreeing with those two out of three physicians, because there are multiple ways to get to the same goal, but it shouldn't involve such a trauma of doing a double mastectomy for something that is DCIS. DCIS, ductal cell carcinoma in situ, most of the time resolves on its own. However, if there is a family history, if there's significant personal history, and especially on background of hormone imbalance, then maybe a lumpectomy would be necessary, with maybe local radiation or not, an investigation of those lymph nodes. So it is very traumatic to reach the conclusion that just because it is a form of cancer, it should result in double mastectomy. It causes significant physical, emotional, and mental trauma for any woman with such a diagnosis and medical recommendation. And I think that any physician should welcome and even refer the patient for a second or a third opinion, because it would be a learning experience for them as well, not only for the patient.
Very good. And that's exactly what I wanted you to share is, what if a woman came to you in those circumstances, or any woman that is out there listening, what are some of the things that they should do in those cases? And oftentimes we find that women and the care that they receive is not often at some, I won't say often, at times it's not in alignment with what may actually be in their best interest. It may be what the doctor at that time thinks. And if that doctor is able to get that second or third opinion to compare it, like you say, is there a consensus? We need to look for a consensus among even the medical professionals to see what would be the best alternative. And just me talking to you, and in no case was I her patient at that time. We were talking as friends, and then she shared with me, I would recommend that you get a second opinion, at least, and see a functional medicine physician, which I am going to see the functional medicine physician as well. So in my situation, I got a second opinion, and that second opinion did not agree with the first opinion. And the reason I'm going with the second opinion is not because of what I heard, but because it was in line, not because I got the answer that I wanted, because I like that you shared that too. We shouldn't seek for someone to tell us what we want to hear. We need to seek to see what is in our best interest. And I happen to be a person with um, four on my paternal side, four relatives that have had breast cancer. On my maternal side, multiple people with breast cancer and all forms of cancer. Um, so I had a very strong history, familial history, that gears me towards being someone that could be considered high risk. But the lumpectomy at least gives me the opportunity to also make changes in my health, and to treat myself naturally and holistically to reduce my risk. And that's what my goal was. And talking to you helped me to understand I can do the work to heal my body. I don't need the opportunity to do that to just be robbed from me completely, not just yet. So let's give the body time to heal, and for me to implement the things that can improve my health overall. So I want to thank you for taking that time, and just talking as friends, to tell to give to flicker off something in my brain that said, no, Tina, don't schedule this surgery just yet. Get a second opinion, or a third one. I actually had a third one waiting too. So
Absolutely, always, whenever you're able to. And like I said, and you second that, don't look for an answer that exactly resonates with what you expect to hear. Do your own research, but
exactly.
absolutely look for a consensus. And on point to a familial history of breast cancer, women out there, you need to remember that genetic predisposition does not equal fate. So there, we're talking about epigenetics. How is it that we are reacting to the environment? Epigenetics is how do we switch on or off that button on gene regulation and allowing that predisposition to actually manifest itself. So
Mhm.
if we do everything within our power to decrease the amount of chemicals that we are exposed to that are promoting that erroneous estrogenic effect, but we also balance it with progesterone. So whether you have a uterus or not, make sure you are on progesterone. I do not second estrogen only therapy because breast and uterus need to be preserved, and there are estrogen and progesterone receptors on every cell of the body. So simply because we get rid of the uterus, it doesn't mean that we have to ignore the rest of the cells of the body that would benefit from progesterone. So just because you have a familial history of breast cancer doesn't mean that you will necessarily develop breast cancer. If
Mhm.
you do not know your BRCA status, I do recommend that you invest into a genetic study to see where your risks are, because that literally increases your risk for breast cancer by 80%. So knowing where you are and knowing your background always helps to formulate a path forward.
Exactly. And I did get genetic testing done. Well, I got it done twice. I got it done on my own, and then I also got it done through my insurance. So I'm still waiting for the results for both. They can take a good length of time sometimes to get them exactly right. But I just got a notification that some of those results are in. So I'll be sharing with you all what those results are, and how that impacts, my future decisions. But I do feel comfortable and confident, with the research that I did and knowing my history that a lumpectomy would be the best option for me to go with. I know that some people go through. You mentioned something about the psychological and mental trauma
Mm.
that it can cause for people to have something like a double mastectomy. And actually, in my interview with my doctor, well, in my session with my second opinion, she said that if someone came into her and asked for a double mastectomy just because of atypical ductal
Mhm.
hyperplasia, she would actually refer them to a psychiatrist to
That's an
check.
excellent point. I agree.
She
It's a
and
really
she
extreme
said,
case. I understand what's driving that recommendation.
yeah. So, and listening from another doctor, see, there's consensus on this. Yet another doctor says she agrees with that. That if a person just from just hearing about atypical ductile hyperplasia, because mind you, that's not actual breast cancer. It can be a precursor to it, to cancer. So let I want to make sure we explain that what I had is not breast cancer. It is has for many been a precursor to it. And that's why some people, especially if they have BRCA, a positive BRCA test, and may decide to get double mastectomy, or may decide to take that leap. But that doesn't mean that that is their only option, because as you mentioned, even with a positive BRCA testing, my doctor, the second opinion I got, said it does not mean that you are going to develop breast cancer. It just means you're at a higher risk and we need to monitor you more closely. So that means, the mammogram and MRI being completed every 6 months just to check and see what's going on there. But does not necessarily mean you have to go to the mastectomy. Now, in this conversation, are we saying that there is something wrong with getting a double mastectomy? I would like to say no. I'm not saying that there's something wrong with you choosing to do that for your body. What we're recommending, though, is that you get second and third opinions to make sure that that though there's consensus that that level of treatment is needed. And also, as was mentioned, as my doctor stated, she would make sure that the person is really mentally and emotionally where they need to be before they make that type of decision. When you say you agree with that, can you explain why you agree with the getting psychiatric, being referred just to check, just in case?
Because I think that some physicians scare women into getting a radical procedure as if that is the answer to everything. You will still need hormonal balance. Otherwise, your quality of life is going to suffer. And on top of that, you have the physical, emotional, and mental trauma of going through a double mastectomy. As much as one can prepare for something like this, it is ultimately still traumatic.
Mhm.
And I think it affects a person's lifestyle on all aspects possible. And if it's something that can be prevented, if we can do just a simple lumpectomy, maybe local radiation, monitor, optimize hormone levels, improve lifestyle, and everything that involves hormone balance, I think it's a better mitigating pathway to move forward without a radical mastectomy. I think it's easy. Maybe I'm a little bit sexist now saying that I think a male physician is more likely to offer the idea or push for bilateral mastectomy. But if you are to ask a man that has erectile dysfunction, do we just chop it off because it doesn't work? Or we actually look for root causes to make it work, to improve what's going on that's manifesting, right? So it's the same thing. We shouldn't just be chopping off organs simply because of a diagnosis. Let's look at how to cause the minimum type of disruption and improve everything else, in
Mhm.
my opinion.
I and I I'm going to tell you something. This conversation is actually the direction that it's went in actually can help so many people because they're hearing it from someone who has been through it and they're hearing it from the right professional, who has experienced the knowledge as well. You made a statement that men are more likely to tell a person to have a woman to have the radical procedure. I'm going to validate that because it was a male doctor who I went to who is considered to be the top of of one of the top professionals in, maybe in the nation, actually. Um, but he told me that he recommended, based on my family history, a double mastectomy, and that he was going to give me a great boob job, as if that was going to make things any better, and already was giving me the plastic surgeon's information and everything before doing an MRI, before doing genetic testing. I'm already getting appointments with the plastic surgeon, and I just, through that process, it was shocking to me. I was in a form of shock, to be honest with you. And that's why I know, I have a strong belief in God. And I know that us having that conversation as friends, let me repeat that, at that time, actually really was the perfect timing for our discussion, because it really helped me to see, okay, let me go check out a woman doctor at that, and see. And this female doctor happened to be trained by that doctor in her when she was in school, because he's an elder doctor, and I would say that, and he has trained a lot of the professionals in this area in reference to breast cancer and breast surgery and things of that sort. And it was a total different experience. I spent 10, maybe 15 minutes with him. Majority of the time was with his nurse practitioner. With her, I spent more than an hour. This doctor actually spent an hour going through my history, going through how I felt about it, any questions that I had, really explaining the meaning of what each thing was. And I was just like in awe. And this time my husband came with me because he was prepared to say, let's get out of here and go to the third opinion right now. But that's what I recommend too in those situations, is consider taking someone with you too, because sometimes you can be in shock and you may not even be processing well what's going on, and that person is going to be able to ask the questions that you should be asking. So wow, I just have gotten so much from what you said. Dr. Elena, you are quite an amazing practitioner, physician, and woman. And I love the fact that you also feel comfortable to say the things that some people avoid saying, are afraid to say.
Thank
Um,
you. I know we have to be politically correct most of the time, and I'm not trying to point the finger or discredit the physician, the male
mhm,
physician that you saw. His credentialing may be, stellar, and his practice as well, and as well as his experience, since he is elderly. But this is a bit old school type of treatment. And of course, it's deferred to the nurse. So the nurse is going to come in and explain everything that comes with it, and
mhm.
that's pretty much it. It's an approach that is like out of sight, out of mind. But for a woman, it's not going to be out of sight, out of mind. There's a lot of implications, even single mastectomy, should not be a lonely process. A significant other, family should be involved, because the person will need that support. But
Very
a
true.
proper medical appointment should be where both the physician and the patient are involved in the care. It's not what the physician says and the patient does. This is not the principal's office. This is about reaching a joint decision that benefits the patient.
Mhm.
So I, as a physician, I will impart my knowledge, my skill, my expertise, and I will want you, based on what you heard, to make a decision. But I would feel very comfortable to send you for a second or a third opinion, because the more you hear and the more you are exposed to, it helps you reach a better decision. Information is key, right? So having that awareness will help you make better informed decisions about your health.
Wow, this is powerful. See, knowledge is power. And we have to lead, for me, I know that the old school method of care is not the best for me. And being a person who, because I have a very complicated health history, and I really do need someone who is going to look at the whole person and then be able to really provide me options and encourage me to second and third opinions if necessary. Because I can't change genetics. I can't change also some of the things I've done in the past that may have not been in the best interest of my health. But what I can do is change what I do going forward and make sure that I advocate for myself and that I take someone with me, like you say. And I realize too that medical treatment is not a dictatorship. It's supposed to be a team effort between the doctor
Absolutely.
and the patient, like you mentioned. Wow, y'all. So, Dr. Alawa, where are you practicing?
I'm practicing in the state of Michigan.
Okay, in the state of Michigan. So we can only work with you if we are in the state of Michigan.
That's correct, unfortunately. Yes.
Okay, I was trying to see if something had changed. Um, because I promise you, if I lived in Michigan, I would hire you without a doubt, like right off the bat. I think that's also part of the disappointment after that conversation was that you could not be my doctor. But I do appreciate all that you have shared. There is so much good information in everything that was shared today, and being able to share it as transparently and as directly as you have, I loved it. I know that the audience is going to love it too. So, could you, besides the fact that you live in Michigan, could you tell the audience how they can find you?
Absolutely. They can find me online at truehealthsolutionsclinic.com. I'm on Facebook, Instagram, LinkedIn, same handle, True Health Solutions Clinic.
Okay, very good. True Health Solutions Clinic. Check them out, especially if you are in the Michigan area. If you're not in the Michigan area, follow them in all of those locations. She and her practice does provide very educational content that is I enjoy the content very much. So I enjoy content, as y'all know, as a person who is also on Instagram and Facebook and all those places, that it educates, inspires, and motivates. And that's exactly what I get through the content that the true, say it again because brain fog hits me.
That's all right. True Health Solutions Clinic.
Clinic. Okay, True Health
TrueHealthSolutionsClinic.com.
Solutions Clinic. Check them out on all of those locations, as well as if you live in Michigan, follow not only follow her on those social media platforms, but if you're looking for a integrative or functional medicine physician, I highly recommend Dr. Lawa. So thank you again for joining us. And we look forward to seeing and having you share your knowledge with us again. I'm hoping that I might possibly get you to do that again at the Inflamed Sisters Thriving Summit and Gala that's taking place September the 23rd, 2023. I mean, if I could just get you down here, I mean, that would be amazing. But
We
in
will
the
have to chat after this, but thank you. I look forward to it.
Yes, awesome. And before we leave, I do want to let you all know, just as a reminder, on Saturday, April 22nd, 2023, Nurse Loves Essentials LLC, my company, is going to be hosting the first Inflamed Sisters Thriving Boss Brunch and Network event. And this is a live in person and virtual event made for entrepreneurs where you'll have a safe space for women who desire to grow thriving businesses without sacrificing their health, where they can learn the ways in which you can do just that. So, click the link in my bio in order to learn more about that. And in the meantime, remember, my sisters, we may be inflamed, but we're still here. And as long as we are here, we might as well thrive because inflamed sisters thrive together always. Have a wonderful day, everybody.